So I was at the University of Wisconsin clinically, working as the acute care surgeon. That meant I was covering the trauma service, the emergency general surgery service, and the surgical critical care service. We did burn call, but it was just at night. So I didn't staff the burn service during the day. My typical day when I was on service, so we would have a sign out meeting at 7 o'clock. Before the pandemic and everything, it was all in person, and then we switched to doing it on Zoom so that other people could also join if they wanted to. And so we would start at 7, and then that day afterwards really depended on what service I was on. So if it was the critical care service, we would go around on the ICU patients in the morning. Those rounds typically got done, somewhere around 11 noon, something in that nature. We would have a bunch of family meetings often, or follow up with different consultants and different parties in the afternoon. And then we kind of do a sign out at the end of the day. If it was the trauma service or the emergency general surgery service, that really just depended either on what traumas were coming in or what surgeries we had scheduled for that day. And a lot of times, you wouldn't necessarily know what your day was going to look like. So some days you'd be in the operating room all day, especially if you're on the EGS service, and then you kind of fit in seeing patients and rounding in between cases. Other days were a little bit less hectic. So